Hi there, my name is Brady Woolman and I am a nursing practitioner student doing a case presentation of a patient with abdominal pain for 518. My patient's name is Mrs. B. She's a 54-year-old woman who presented to the clinic this morning around 9 a.m. with abdominal pain being her chief complaint. On further assessment of her history, Mrs. B has characterized the pain as a dull, cramping type that is located just under her belly button, and she also stated the pain is getting progressively worse since last night. The pain is mostly in her periumbilical area. However, it has started to radiate towards her lower right quadrant of her abdomen. She has stated that the pain started mildly around 11 p.m. last night and woke her up several times throughout the night. The pain has been constant and hasn't subsided since it started and is getting more intense as time goes on. And she has now rated her pain to be 8 out of 10 in the last hour. Mrs. B said nothing she has done can alleviate the pain and has tried hot packs, the shower, and position changes. However, she did take 2 Advil before going to bed, which dulled the pain a little bit, but the pain came back just as bad when the Advil ran their course. She has stated that coughing, walking, and moving also makes the pain worse for her. When asked if she has any other symptoms other than the abdominal pain, Mrs. B did mention she woke up this morning with a low-grade fever. She has been quite nauseous and therefore she hasn't been able to eat anything for breakfast today. Mrs. B has denied any chest pain, any shortness of breath, any changes in bowel patterns, including no blood in her stool, any dizziness, or any loss of consciousness. For her past medical history, Mrs. B did have chickenpox as a child. She has type 2 diabetes now, currently, which is controlled with diet and exercise, and she's not taking any medications for that. She has had 2 C-sections with both of her children in 1994 and 1997, and no added complications from those surgeries. She also has had no other surgeries to date. She has no history of any mental health illnesses or issues. She has 1 known allergy to morphine, which resulted in hives all over her body, and this occurred right after her C-section in 1994. She doesn't take any prescription medications, but will take Tylenol or Advil for headaches or any aches and pains if needed. She is up to date on all of her immunizations, and her last menstrual period was March 1st, 2019. She also reports having a normal menstrual cycle. Her family history includes Mrs. B's mother has a history of high blood pressure, and her father passed away 2 years ago from lung cancer in his 70s. Her older brother and younger sister are generally healthy and have no significant health conditions. Her personal and social history include that Mrs. B has been married for 27 years. She has 2 children, ages 25 and 22, and she reports being in a happy marriage. She eats a healthy diet, drinks alcohol socially, denies any tobacco or recreational drug use, and tries to work out 3 to 4 times a week. She also works part-time as a grade 4 teacher currently. On assessment, after doing a complete review of all of her systems, I did narrow Mrs. B's assessment to an abdominal assessment. On examination, Mrs. B's vitals include a blood pressure of 129 on 85, a temp of 38.2, which is a bit elevated, a pulse of 92, and a rest of 20. Mrs. B appears in pain with occasional moaning and clutching her right side of her abdomen. Her color is good and no diaphoresis is noted. On inspection, her abdomen is symmetrical, flat, no rashes or lesions were present, and her C-section scar was noted to be above her pubic bone. Her umbilicus does not look bulging or inflamed. On auscultation, bowel sounds were present, however, they were reduced in her lower right abdomen, in the right quadrant. No bruise were heard over her aorta, renal, femoral, or iliac arteries. No abnormalities were heard during percussion of the abdomen. On light palpation of the abdomen, I palpated all 4 quadrants, with the right side being last, and the patient did report right side tenderness during this portion of the exam. The patient also winced in pain, and it was clear that she was in obvious discomfort during this. No superficial masses were noted in any 4 quadrants. She had a negative Murphy sign, no shifting Donless, and no fluid wave was present when I did my exam. However, she did have a positive Rosving sign when I pushed down on her lower left quadrant. She did feel some pain in her right lower quadrant. She also had a positive psoas sign and obturator sign, and did feel quite a bit of tenderness and pain when I palpated her McBurney's point. In summary, Mrs. B came in with right-sided abdominal pain of 8 out of 10 that began only as a mild pain 12 hours ago. A low-grade fever, nausea, and a decreased appetite is also present. She does not have a significant health history, and on examination, she had a positive Rosving sign, psoas sign, obturator sign, and did have significant discomfort on palpation from McBurney's point. I have a good idea what type of plan we need to make for Mrs. B, including diagnostic testing, and I would like to discuss this with you, as well as which differential diagnoses we should consider. Thank you for listening to me present my case.